1, 2, 3. Test mic. 1, 2, 3. 1, 2, 3.
Recording in progress.
Morning, everyone. I'd like to call to order the meeting of the Insurance Benefits and Ledge Committee for Wednesday. Call to order the meeting of the Insurance Benefits and Ledge Committee for Wednesday, the 7th day of May, 2025.
Thank you, Chair Robbins. This meeting is being conducted virtually and in person, so I will do a roll call of the trustees to confirm attendance. Ms. Ginsburg will not be participating today. Ms. Durazo, Ms. Langton, Mr. Rue, Ms. Hessler is here. Mr. Oakham,
Here.
Mr. Green, Mr. Moore,
Here.
Mr. Kehoe,
Present.
Mr. Harris,
Present.
Chair Robbins.
Present.
Staff participating in the meeting include Deputy CEO Louis Lugo, AEOs JJ Popowich and Laura Guglielmo, Chief Counsel Stephen Rice, Legislative Affairs Officer Barry Liu, Director Retiree Healthcare Cassandra Smith, and consultants Stephen Murphy and Michael Zito from Siegel. Trustees, please use the raise your hand Zoom option to be placed in queue. At this time, we ask all meeting participants to mute your mics until you are ready to speak, and we may now proceed with the agenda. And there are no requests for teleconference meeting under AB 2449.
Thank you very much. Item number 3A, approval of the minutes of the regular meeting of April 2nd. Need a motion? So moved. All seconded. Are there any changes or amendments?
Mr. Oakham,
Aye.
Ms. Moore,
Aye.
Mr. Kehoe.
Aye.
Chair Robbins. Motion passes unanimously.
I'm here.
Oh, you can vote too. Okay, thank you.
Item 4, public comment. We do not have any requests on the public to address the committee. Item 5, reports. 5A, engagement report for April. Mr. Liu.
Thank you. Good morning, Chair Robbins and trustees. Some items of interest this month. First one is an update on Alaska. As some of you may know, Alaska discontinued its pension plan in 2006 due to unfunded liabilities, and they've seen that this has had an effect on an adverse effect on recruitment and retention. So they're trying to revive that plan, but it's running into challenges. It was first proposed in 2023, but it's still ongoing as to whether lawmakers there will agree to reopen the plan. Right now, employees only get a 401k plan, and so that's been, again, contributing to recruitment and retention issues. The next item concerns Pennsylvania. So their retirees are getting a COLA for the first time in 23 years. As you know, these times of high inflation, a COLA is important to preserve purchasing power in a pension. These retirees, however, last got a COLA increase in 2002. So for the last 20 years, that purchasing power for that dollar has been eroded down to 56 cents today. So there's a bill to provide a sliding scale increase from anywhere from 15% to about 24.5% COLA for these retirees whose purchasing power has been eroded. On the other hand, the added benefits would increase their unfunded liability by almost $1 billion. So again, concerns about the cost versus benefits on that. And then the next item is about a debate over pension calculations in Connecticut. So as you know, in our plan, overtime is excluded from pension calculations, but apparently in other plans, they do include overtime earnings in their pension calculations. So there's a bill that's been introduced to exclude overtime from it calculations, again, due to unfunded liabilities and costs. But the flip side of that, opponents of the bill say that because of vacancies and the fact that existing employees are subject to more mandatory overtime, that it should continue to be included in their calculations. So again, as you can see in some of the items, a lot of back and forth between costs and benefits in terms of benefits. The next item is an interesting informational item about state legislators from the National Association of State Retirement Administrators. Here they looked at, well, what benefits are provided to state legislators? As you know, state workers certainly get benefits, but providing benefits to legislators can be controversial. They found that there are, of the 50 states, 10 states provide no retirement benefits for their legislators. Of the 40 that do provide benefits, 20 allow them to opt out of participating. And then the types of plans are offered, 18 of them get a pension plan, 6 get a hybrid plan, 8 get a defined contribution plan, and the remainder get a combination of either a pension and a defined contribution or a hybrid and a defined contribution plan. So here in California, our legislators up until 1990 did have the legislators' retirement system in effect. But in 1990, the Constitution was amended to prohibit state lawmakers from earning pension benefits. Currently, however, there is an Assembly constitutional amendment that seeks to repeal a prohibition and bring back that retirement system for legislators who are serving, who've been serving since 2010. So the constitutional amendment, what that would do is if the legislature passes that, it will then become a ballot proposition to be voted on before the people of the state of California. And the last item concerns Social Security. As you all know, the windfall elimination provision and the government pension offset was repealed, but there was a form, and still is a form that's required to be given to employees in a job not covered by Social Security, such as here in LA County. So previously, the form outlined the impacts of the WEP and GPO. Now that that's been repealed, the form is still required, but what the form does now is inform members that their earnings will not earn them Social Security credits, but they will be subject to Medicare taxes. And so that form will be used, going forward to onboard new employees. So that concludes my report. Happy to take any questions.
Any questions for Barry? I am still getting emails, by the way, from retirees who have not received their retro payment and have not had their new Social Security amount adjusted either. So there are still people out there that are now standing in line at the Social Security offices with half the rest of the world trying to get answers to why they have not received their retro check and if and when they're ever going to have their Social Security correct amount show up in their Social Security check. Item B, staff activities report.
Yes, good morning, Mr. Chair, members of the committee. On the 29th, as you know, we had our wellness event for the retirees. I'm sorry I missed it because I understand that it was of great fun by everyone that was there. I'd like to thank all of our participants, our carriers primarily because they were the sponsors, as well as Siegel, who helped us to organize it and run the whole day. I want to thank Lewis for doing our welcoming for the retirees and those of the committee that attended the event. So a lot of good feedback that we got. Most of the members, over half of them or 90% of them, really enjoyed it, according to the surveys that were submitted. And the last thing is that we started our 25-26 retiree drug subsidy application with the federal government. For those that are new on the board, we participate in the federal program where it allows the sponsor to receive some funds back from the federal government. And so we've started that. We've been participating in that program since 2006. We are looking at possibly changing that. We're still in the research of changing over to what they call an EGWIP, or the Employer Group Waiver Plan, which would allow us to obtain additional funds from the federal government on behalf of the plan sponsor. So we'll keep you informed of that, how that goes. And that's it.
Thank you very much. Item C, claims experience. Michael.
Good morning, trustees. So the first exhibit contains the premium and enrollment through March of 2025. The distribution of premiums and enrollment remain consistent from the prior report. Next exhibit, please. This exhibit contains the claims experience for LACERA's non-Medicare plan. For Anthem's non-Medicare plan, the year-over-year trend increased by 10.4% for the 12-month period through March of 2025, which is a 0.4% decrease compared to the prior report. For Cigna, the year-over-year trend increased by 5.6% for the 12-month period through March of 2025, which is a 0.6 percentage point decrease compared to the prior report. And for the Kaiser California non-Medicare plan, the year-over-year increased by 9.2% for the 12-month period through January of 2025. Next exhibit, please. This contains the claims experience for Anthem on an aggregate basis and by plan. For all plans, the overall year-over-year 12-month rolling trend increase by 9.3%. For plans 1 and 2, the year-over-year 12-month rolling, the year-over-year trend increased by 10.5%. And for prudent fire, the year-over-year trend increased by 9%. And for plans 3, the year-over-year trend increased by 6.4%. Next exhibit, please. This contains the Kaiser utilization report, and it's been updated through January of 2025. So the overall claims experience on a per member per month basis increased by 10.1%. For the inpatient claims on a per member basis, the cost decreased by 4.8% due to decreased utilization. For outpatient claims on a per member basis, for the most recent period, it increased by 19.8% due to increased claim spend from emergency rooms and hospital outpatient surgery. And for the pharmacy claims, the claims on a per member basis increased by 10.8% due to increased utilization from brand name medication. Next exhibit, please. This contains the high cost claimant report, claims experience for Anthem, Cigna, and Kaiser. For Anthem, the rolling 12-month trend as of March of 2025 represents a 132% increase due to increased number of individuals reaching the pulling point of $400,000 and claim spend increasing by more than 100%. For Cigna, the year-over-year trend increased by 15% through March of 2025 due to one individual exceeding claims of $1 million. And for Kaiser's non-Medicare plan, the year-over-year trend decreased by 15.8%, mainly due to large claims activity reaching the pulling level. Next exhibit, please. This contains the Anthem lifetime maximum accumulation benefit. So from February of 24, we had 194 individuals at risk of reaching the lifetime maximum benefit, and that number decreased by 3 individuals to 191 in March of 2025. The majority of the members at risk reside within plans 1 and 2, and there's a multitude of factors that impact the change due to individuals selecting plans with LACERA's help and individuals passing away. Next exhibit, please. This contains the pharmacy rebates exhibit, and it will be updated in the future report. Next exhibit, please. This contains the dental and claims experience. For the dental claims on a per retired per month basis, it decreased by 0.3% for the current period. And for the vision claims, the year-over-year trend increased by 4.7%, which is consistent with the prior period, prior report. Thank you.
I've got a question. Since Kaiser is down 15%, at least on that report you just told us, what will that do to the increase next year at Kaiser? Will that keep it? Will that be real helpful?
So that 15% decrease, it's a reflection of the large claims. So that's not inclusive of the total claims. So the total claims are actually increasing by 10% year over year.
So this is normal. What you were just saying there is about a 10% increase. And where is that coming from? Is that coming from increased cost? Is that coming from Medicare? Where is that 10% coming from? On basically all plans. I'm talking about not large claim. I'm talking about normal insurance.
Trustee Holcomb, so the exhibit that Michael was going through, can we go back one exhibit, please? To the Kaiser illustration. Couple more.
Gotta go one more. Yeah, that's it.
Two more. Off the top of my head. That one. There, I like that one. All right, so this exhibit is for the Kaiser population that is not Medicare eligible. So it is the smallest component of the Kaiser population. However, I think if you look at the materials, I think on an inpatient basis, claims were down by about 5% compared to the prior period. However, outpatient services and pharmacy were both up by double digits. So that's going to be kind of a key driver. Pharmacy is typically being driven by specialty medications, which are used to treat oncology and other rare conditions. So we are seeing it's a small number of patients, but the expense associated with that treatment is very high. So it's kind of a bit of a trade-off. We're getting kind of cures and remissions, et cetera. So it's quality of life is certainly enhanced, but it comes at a cost. For outpatient services, a lot of services are being pushed out of the inpatient arena into outpatient services. So it's kind of a natural kind of trend or flow. So that makes sense to us. So overall, that's probably a good starting point. Because Kaiser does kind of what they define as a budget-based renewal approach, which is they determine what their system needs for funding. That's for staffing, materials, et cetera, plus whatever the utilization might be. So they budget that on a global basis, and then they adjust that for each group on a adjusted basis based on membership, demographics, plan design, and other factors. So we'll have to see where that goes. I would say a bellwether for us would be when CalPERS kind of presents what their renewal results were, probably in late July, early August. That'll give us a good sense of, particularly for Kaiser, what their overall budget is and what we might anticipate for your renewal, which would be 7/1/2026. So a little bit early in the process for us. We'll actually begin your renewal process in October with earnest. So we'll do that process, and that typically goes from October through the end of the year. We're working with the carriers kind of one-on-one. And then we meet with LACERA staff and those vendors in January to finalize the renewals, which we did this year. So we'll follow that same cycle.
Steve, but what is causing here? You're about 10% in all Kaiser, Anthem. I forgot Cigna. Cigna's so small, it doesn't make any difference. But the 10% and these increases, is it just more usage, or are they increasing the costs? Where are these increases coming from?
It's definitely a combination of the two. We're seeing more utilization, particularly like the specialty medications, more members using very expensive drugs are pushing some of that. But we are also seeing more utilization broadly, but there's also price inflation. As an example, post-pandemic, medical groups, Kaiser, et cetera, had to staff up. Many were using temporary staffing during the pandemic as many professionals were choosing to quit during that time period. So they were either using temporary staff, which increased costs, or they're having to hire them at a higher price point than they were previously. So we're kind of getting that dual edge.
Yeah, but that's over now. I mean, really.
They're still staffing, so they're still understaffed to serve the population needing services. So the initial blip, yes, but I think we're still seeing that residual impact of kind of the upheaval that occurred as members kind of walked away from hospital staffing positions, ER positions, et cetera.
One more question.
Sure.
They got a medical school. And if you go there, it's free. You know that?
Mm-hmm.
Okay. Now, if you go there free, do they have to work for Kaiser for a number of years?
I would defer to the Kaiser teams, but my recollection is they're not required to work for Kaiser, but it is certainly, I think,
Why would they have a free medical school and not have to work for 3 to 5 years to give back to Kaiser, who gave them? You know what the philosophy is?
I do not. I kind of found that odd myself. I had the same premise, which is you're going to use that as a window to train your staff. But I think for those that are trained in the Kaiser Medical School and go elsewhere, I think their belief is that their philosophy would kind of be dispersed and shared with others.
That's pretty expensive. I mean, we know where it is. It's right down the street here. And then, I
Right.
mean, you're talking, I don't know how many students. They got to have 50 students. So that's got to cost them an arm and a leg. I hope it's not related and they charge us more money because they got a free Kaiser Medical School.
I'd let them answer that question.
Okay, thank you.
I think we're
Well,
finished with the,
Steve?
we just introduced the name. I have a couple items in your information packet related to compliance news. First one is implementations of Medicare changes for group health plans. 2 items of importance for LACERA. One is credible coverage. Credible coverage means that the pharmacy benefit that you offer through your plans, particularly for those that are not Medicare eligible yet, so the early retirees, making sure that that pharmacy benefit is equal, comparable to, or better than what is available on the individual market for Part D plans. Your plans meet that threshold. and your plans will continue to be credible going forward. That's an important issue because for the members that don't have credible coverage when they transition to retirement, they may be forced to pay a penalty into Medicare to kind of purchase Medicare Part D. Again, not directly related to your retirees, but that's kind of how it works in the outside world. Secondarily, there's a price increase going to kind of Medicare Advantage providers. For the last couple of years, that has been narrowed and reduced. It's actually being increased this year. So I think the net result is we're looking at about a 5% payment increase to the Medicare Advantage plans. That will do one of two things. That will either offset the increasing costs we were just talking about, kind of getting them back to back even, or if those funds are enough to cover trend increases, that could have an offsetting impact to the rate. So we could kind of go back to kind of more favorable increases for the Medicare Advantage plans. If you go back like 5 years, we probably had a string of perhaps 3 or 4 years where we're seeing negative pricing for those Medicare Advantage plans as we kind of exited the pandemic. Those shot up by kind of single and double digit increases. Not quite sure how this will play out, but again, we have the opportunity to take a look at what CalPERS does as a kind of bellwether to give us a sense of what we might be looking at July of 2026. So that's what's in the first set of updates. The second one is on executive order seeking to lower prescription drug prices. I think feedback is due back to the president in 180 days. That's around October, and it's looking at a combination of things: importation of drugs, revised provisions, legislation, et cetera. And as it's described, it's kind of broadly written. So I guess we'll kind of see what we get, and I will reserve judgment on anything beyond that. So we'll see what we get in 180 days. But thank you. So that's all I have to share today.
Thank you very much. Items for staff review, number 6.
Have nothing.
Items for future agendas, we have nothing. We'll just let good of the order go with the regular board meeting. And if no one has any other questions, motion to adjourn.
So moved.
Adjourn.
Recording stopped.